From plan to impact. There's a village in northern Ghana called Amanvasi, a place full of life but also full of silent struggles. Pregnant women travel miles before seeing a nurse. Children miss vaccinations, and when emergencies happen, help comes too late. Now, one day, a team from the district health office arrives with a big promise. We are going to reduce maternal deaths in Amanvasi. Sounds like a plan, right? But here's the truth: a plan alone doesn't save lives, implementation does. The plan: the team gathers under a tree with community leaders. They assess the situation: high maternal mortality, poor access to health facilities, lack of skilled birth attendants. This is where health planning begins. They allocate resources, funds from government and donors, midwives and community health officers, medical supplies. Then they move to programming. They ask the key questions: what activities will be done? Who will do them? When will they happen? What resources are needed? So they design a program, train midwives, build a CHIPS compound, provide emergency transport, start antenatal outreach services. Everything looks perfect on paper, but paper doesn't save lives. Implementation begins. Now comes the real test: program implementation, the execution of planned health activities to achieve desired outcomes. This is where plans meet reality, budgets meet challenges, and ideas meet people. What actually happens during implementation? Let's step into Amanvasi. Service delivery. Midwives begin attending to pregnant women. Vaccinations are given, babies are delivered safely. Coordination. District officers and community leaders work together. Without coordination, if effort would clash or fail. Supervision. Supervisors visit regularly to ensure protocols are followed. Staff are performing well. Quality of care is maintained. I'll take that again. Supervision. Supervisors visit regularly to ensure protocols are followed. Staff are performing well. Quality of care is maintained. Logistics management. Medicines, vaccines, and equipment must always be available. No drugs, no service. What determines success? Now, listen carefully. This is where many programs fail. Even a good plan can collapse if these factors are weak. 1. Availability of resources. No money, no drugs, no transport is equal to no implementation. In Amanvasi, fuel shortages delayed outreach services. 2. Health workforce capacity. Are workers trained, motivated, enough in number? One midwife handling 50 patients a day. That's system under stress. 3. Leadership and governance. Strong leadership ensures clear direction, accountability, decision making. Weak leadership, confusion and failure. 4. Community engagement. Do the people trust the system? In Amanvasi, some women preferred traditional birth attendants. So the team had to educate, involve community leaders, and build trust. 5. Infrastructure. No roads is equal to no access. No buildings is equal to no services. The chip compounds changed everything. 6. Monitoring and evaluation. Tracking progress. Are maternal death reducing? Are more women attending antenatal care? Without monitoring, you are working blind. Now let's look at the challenges. Implementation is never smooth. In Amanvasi, problems showed up. Inadequate funding made projects delayed, weak data systems, poor decision making, poor coordination, duplicated efforts, unrealistic timelines, pressure on workers, staff shortages, they were burnouts. And here is the danger: if implementation fails, the entire plan will fail. The turning point: the team adopts the CHIP strategy. Community health officers move into the village, home visits begin, pregnant women are monitored closely, immunization reaches every child. Now something changes. Women no longer travel miles, care comes to them. The results: months later, more women attended antenatal care, skilled deliveries increase, and maternal deaths begin to drop. Why? Because implementation worked. Listen carefully. This is what you must never forget. Resource allocation decides what gets funded. Programming design decides what will be done. Implementation ensures it is actually done. And the biggest truth: allocation without programming is waste, and programming without implementation is failure. Implementation without monitoring is poor outcomes. So, next time you hear someone say, "We have a great plan," ask them one question: can you implement it? Because in health systems, lives don't depend on plans, they depend on execution. This is Eric Podcast.